Hello everyone, I'm Deanne, the Vice President of Human Resources for Crestline. Crestline cares about its employees. We want to be certain that you all are aware of a very important law that will affect you in January 2014. It's called the Affordable Care Act. This law requires that employers, like Crestline, provide health insurance that meets certain requirements, including how much you contribute, and what the insurance provides to employees and their dependent children. So what's the big deal, you might ask, because Crestline does this already, right? Well, the law also requires that employees, all of you, purchase insurance for yourself and your dependent children. This is referred to as the individual mandate. Even if you are not a full-time employee, this individual mandate applies to you too. Over the next few minutes, Lenka Adamkova, our benefits manager, will explain to you what the individual mandate is, how it may impact you, and what you need to do to make sure you're abiding by this new law. Please pay attention to this very important information. Lenka?
Hello everyone. We know that this new law is complicated, but we are going to do our best to focus on what you need to know and do. As Deanne said, Crestline will continue to offer its health insurance to all full-time employees, their spouses, and their dependent children. If you worked an average of 30 hours a week from October 6, 2012 to October 4, 2013, you will be considered full-time employee under this law and will be eligible for Crestline's health insurance in January. What this means is that you will either have to select a health insurance plan from Crestline and enroll during open enrollment in November, or you have to purchase health insurance from the government through what is being called an exchange. So what's an exchange? An exchange is like a marketplace on the internet. There will be many different insurance carriers on the exchanges, like United Healthcare and Aetna. The carriers will most likely be different depending upon the state you live in. All the plans will be the same in what they offer. The costs will vary based upon the plan you select, just like Crestline. For example, Crestline currently has 3 plans to choose from: Choice, Core, and Basic. In the Choice plan, you pay more each pay period, which is deducted from your paycheck, but pay less when you have a medical situation. In the Basic plan, you pay less each pay period, but more when you have a medical situation. The Core plan is somewhere in between. On the exchange, there will be a Bronze, the least expensive plan, like our Basic plan. There will also be a Silver, Gold, and Platinum, most expensive plans, which will follow the same philosophy Crestline currently has in place. Part-time employees will have to go to the exchange for health coverage because they are not eligible for Crestline insurance. Full-time employees who decide not to have Crestline insurance may be able to get insurance under their parents' plan, their spouses, or a same-sex domestic partners plan, or you can choose to buy insurance on the exchange. Some employees may be eligible for Medicare, Medicaid, or other government-sponsored programs. As some states are going to make Medicaid more accessible, be sure to check with your state Medicaid office to see if you might qualify for this no or low-cost coverage. No matter how you get insured, you will have to have it. In the past, many people decided not to have insurance, and that was okay. However, in 2014, if you don't have insurance for more than 3 months, you will have to pay a penalty. This applies whether you are full-time or part-time. The penalty will be $95 for each adult over age 18 or 1% of your household income. In some cases, you may be able to get help from the government for the insurance purchase on the exchange, depending upon your annual income. However, if you are eligible for Crestline insurance and decide to get insurance on the exchange instead, you would not be eligible for government assistance. More details on this are in the handout that you received. So the bottom line is, in 2014, if you have worked 30 or more hours on average, you have to elect insurance from Crestline, the exchange, or some other source. And remember, there is no federal assistance towards the cost for the insurance from the exchange. If you don't have insurance, you will have to pay the penalty. If you are a part-time employee working on average less than 30 hours per week, you will not be eligible for Crestline insurance. You will have to get insurance on the exchange or another source or pay the penalty. However, you may be eligible for government assistance to purchase insurance on the exchange.
We know this is a lot of complicated information, but we are here to help and support you. We will be sending out more communication in the near future to help you understand this new policy. In addition, you will receive a notice about the exchanges that all employers must provide to all their employees, full and part-time. Again, we are here to help, so please reach out to your Human Resources representative with any additional questions, or you can go to www.healthcare.gov. That's www.healthcare.gov. On behalf of Crestline, thank you and be well.